Hi, I'm Dr. Jeffrey Antimarino from Bellissimo Plastic Surgery and Medi-Spa. And tonight is our third live Facebook chat. And tonight's topic, we're going to discuss sun protection. As it is summer, we find that there's a lot of misinformation about sunscreen and the use of sunscreen. So we wanted to have about a half an hour to go over that. Many people that know our practice know that we have a big priority on education. And so this summer we decided to start a Shades of Summer campaign to help educate and bring awareness to the importance of skin protection and also eye protection from the damaging rays of the sun. Growing up in California, that we didn't really think about it too much, but we're going to talk about tonight the growing rates of skin cancers all across the globe. So hopefully you'll stay tuned and learn something from it. In talking about the Shades of Summer campaign, it's a two-prong approach. The first one is a sunscreen drive, and we've encouraged our patients and our friends to donate sunscreen to any of our locations, and you can find that on our website and also on Facebook. And what the effort is to collect all the sunscreen, and by the end of the month, we're going to donate the sunscreen to two groups. The first one is the Women's Center and Shelter of Greater Pittsburgh. The second is United Fit for Children. We think it's important to add kids to this because if we can start kids using sunscreen early and show them the importance and also how to use it correctly, which is the big problem, then maybe we can kind of avoid some of the growing rates of skin cancer. The second prong is kind of fun. We have a large gift basket that we're giving away, and you can enter to win this on our Facebook page. In that is our sunscreen products. We're offering a facial with Tara, our esthetician. And we also have a really nice pair of Ray-Bans that were graciously donated by our guest tonight, Dr. Alicia Talega. She's the owner of Shadyside Eye Associates and has been a longtime friend of ours and has been on board really trying to educate the importance of not only skin protection but eye protection. Mm-hmm. So without much further ado, I want to introduce Dr. Talega.
Hi, thank you. I'm so excited to be here, and like you, at my practice, I also like to educate people because prevention is the best medicine. So I'm excited to talk a little bit about UV exposure and what that can do to your eyes, the inside of the eye, the surface of the eye, different things like that. So thank you.
Great. All right. And in the fashion that we've done before, Ella will be asking some frequently asked questions of us, but feel free to ask any questions that you might have, and we'll be happy to answer them tonight.
Hello, Dr. Antimarino. Can you explain a little bit about why sun safety is important to you and the practice?
As I said before, we're in summer. The rates of cancer, skin cancers, melanoma, squamous cell, and basal cells are actually rising rapidly. Melanoma across the globe is rising rapidly. And so we're trying to get the word out that we can actually bring these rates down with some simple measures. The problem is that we always talk about sunscreen, but the biggest thing is that people don't use it correctly, and a lot of studies show when you use it correctly, you're not using enough. So that's the whole purpose of tonight.
July is UV Safety Month. Are there different types of UV rays?
There's actually three UV rays, UVA, UVB, and UVC. UVC you don't really hear about because it doesn't penetrate the atmosphere, but UVA, it's easy to remember. The A in this case would stand for aging, so it does cause your skin to wrinkle and age quickly. UVB has been the culprit over the years about being the ultraviolet light that causes burning and skin cancer. But the studies show that UVA and UVB will also, both together, will cause cancer. So sometimes when we were talking about maybe some tanning beds usually focus on the fact that they use UVA light. The problem with that is UVA has also been shown to cause skin cancer, so you need to be protected from that.
Should we be wearing sunscreen year-round?
Again, the misinformation is no only when the sun is out, but if anybody out there skis in the winter, you know that you can get a sunburn just from the glare off the ice. Studies show that 80% of the ultraviolet lights coming from the sun can penetrate the clouds. So UVA and UVB certainly penetrate, and So if you're out in the exposure, even on a cloudy day, you need to you'd be using sunscreen.
How do you know what SPF is right for your skin?
Here's the funny thing about SPF. The numbers don't really mean that SPF of 15 is only half as good as SPF of 30 and 50 is only half as good as 100. What that number is, it's a sun protection formula, and basically what it's telling you is that SPF of 15 has 15 times the protection of the sun than if you weren't wearing any sunscreen at all. 30 would be 30 times. So in essence, SPF of 15 gives you more time that can be out in the sun and be protected. So think the misinformation is that, well, I better use a 50 because that's better than a 30. But the number doesn't really correlate to the amount of sun blockage. SPF of 15 will block 94% of the sun's rays, SPF of 30 will block 97%, and SPF of 50 will block 98%. So even an SPF of 15 is good. What we usually recommend is somewhere between 30 and 50. More than that really isn't much more help. If you have sensitive skin, they contain more chemicals, so that may be a problem for your sensitive skin. So start with 30, see if you tolerate that. If that's still a little bit harsh, then you can back it down maybe to an SPF 15.
Is concealer or makeup with an SPF effective?
They are effective, but you also have to, what we know about sunscreen is you have to reapply them, and the recommendation is about every 2 hours. If you use makeup with SPF, you still have to reapply it because after a couple of hours the SPF starts to wear off, and with sweat or if it gets wet. So unless you want to reapply your makeup, you probably would be best to put sunscreen underneath it as well.
Are spray sunscreens effective?
Spray sunscreens are effective, and that's usually what we use for little kids. The catch on that is that most people don't use enough, and you should use enough that you get kind of a wetting of the skin and you have to rub it in. If you're just spraying it just so that it's kind of on the skin, it's probably not enough sun protection. The other misinformation is, especially with your kids, you get them to the pool or to the beach and you spray them down right there. They're already out in the sun, they go right in the water. Any of the SPF formulas take about 20 minutes for the barrier to be set. Studies show that you've already sunburned within the first 15 minutes of being out in the sun. So if you wait until you're out in the sun to put your sunscreen on, you've already got the sun damage you were trying to avoid by the time that the barrier is set and kicks in. So if you're taking kids to the beach, anybody using it, you have to apply it at least 20 minutes prior to being out in the sun.
What about face sticks? Are they effective?
Yes, again, face sticks are effective, but again, using enough and using it in a timely fashion prior to being exposed.
So just to go back, is it true that anything higher than SPF of 50 does not work?
No, they do work, but the SPF of 100 or a 70 has a lot more chemicals in it, and so sometimes that can be irritating to skin, especially for kids. So an SPF of 50, remember, has a 98% blockage rate. You're not going to get much higher with an SPF of 100. There's no SPF that has 100% ray blockage. So, 50 is high enough.
If someone hasn't worn sunscreen for years, is it too late to start as an adult?
It's never too late to start. What we know is that sun damage is a cumulative effect. Most of it we get is when we're kids because we're out in the sun more. As we're adults and we're working more, we're not as exposed. But the damage, if anybody's had severe sunburns, each time you do that, you cause damage to your skin. The more cumulative hits you have, even if it's several years apart, it's still adding to that. So it doesn't matter what age you are, if you can start wearing sunscreen now, it can limit the amount of damage you have. It may not prevent you from getting a skin cancer because it may already be in effect, but it may slow down the process or limit how many you get.
What is your opinion on tanning, sunbathing?
We all look better with a tan and we all feel better being out in the sun. So I'm not going to be a hypocrite and say you can't be out in the sun. Listen, the whole point of tonight is to help bring awareness to how to use sunscreen, the proper SPF, so that you can be out in the sun, that you can be out enjoying the summer months. and do it safely. So your skin is your biggest organ, and you want to protect it. So, with proper sunscreen, you can be out in the sun because, again, you're getting 94 to 98% of the sun blockage, so why not be out in it?
People talk all the time about before they go on vacation that they need to get a base tan.
Mm-hmm.
What are your thoughts on this?
This is one of the biggest misinformation. When we moved here from California, I heard that term for the first time and didn't know what it meant. So basically the idea is that when you're coming out of winter, you would go to a tanning bed and get a base tan so that you wouldn't burn. Studies on that show that a base tan actually gives you an SPF of 4. So it's not even to the lowest that we would recommend of 15. So essentially there is no such thing as a base tan. So I would avoid tanning beds, and the best thing to do is when you come out of winter, start with an SPF of 30 or 50, and as the summer progresses, back it down to a 15.
Are spray tans harmful to your skin?
There's been a lot of advances in spray tans, and there are studies going on right now. Spray tans use a chemical called DHA, or dihydroxyacetone, and the FDA approved that back in the 70s when there was lotion that had this chemical in it. And what the chemical actually does is it mixes with the dead skin that you have, or the dead cells of skin that you have on the outer part of your skin. It actually simulates a tan. So it's not tanning you, it actually mixes with those cells and causes a color change. That's why it only lasts for several days and it peels off, because you're always sloughing that skin anyway. The studies that have been done on it now are seeing if there's any effect when you take it in through your mucosa or you breathe it in, because now it's being used in spray tans, and the color from the spray tans is pretty remarkable. But people are getting it sprayed up around their face, they're inhaling it, and they're getting it in through their mucous membranes of the nose and the mouth. And there may be some potential harm for that, but studies are still being done to really show if that's the case or not.
Will these sunless tanners affect your vitamin D levels?
That's a good question. I just got asked that a couple of weeks ago. Yes, if you're relying on the sun to provide your vitamin D, then using a sunscreen or an SPF of 15 or higher is going to affect that. But you can get plenty of vitamin D through your diet, and that's what's recommended.
I'm going to take it a little different path now. What are the different types of skin cancer you mentioned earlier?
The most common are basal cell cancer and squamous cell cancer. You can identify those if you have little rough patches of skin or an area of skin that kind of breaks down and bleeds a little bit, then it kind of seems to get better, and then it breaks down again weeks later, and it's always in the same spot. It can also be sort of this like a heaped up skin lesion that again gets irritated. Those are things that really need to be looked at. Basal cell again is the most common. Then the squamous cell is the next common, and it's also more dangerous than basal cell. The one that we really try to impress upon people is melanoma. Melanoma can start anywhere on the body. It can start mostly in sun-exposed areas, but it doesn't have to. The thing about melanoma is that it will metastasize, or it will break away and travel to other parts of your body, even when the tumor is very small. So you have to be very careful. What you're looking for most commonly, it starts in moles. If you have moles that have changed color, they were brown, now they're black. If they were kind of brown, now they're sort of reddish, or they start to develop a halo around them. If it was a flat mole, now it's raised. Or you had a mole that was very, very round with a very sharp border, and now that border becomes irregular. These are things that need to be checked out, and you should see a board-certified dermatologist to take a look at it.
How often should you monitor your skin for skin cancer?
I think depending upon your history and also your skin type. I have more of an olive skin, so probably once a year or every other year would probably be fine for me. Somebody more like Dr. Talega, who is fair-skinned and blue-eyed, you should probably be at least once a year. Now, if you've never had a skin cancer, probably once a year, probably starting in your early to mid-30s to start it off. If you've already had a skin cancer, then you should do it at least every 6 months to a year. but you let your dermatologist sort of guide you on that.
Would you recommend having children monitored for their any lesions or?
I think that for kids, I think that as a parent, you can certainly be looking over your kids. Look for moles. Look for black moles that were not there before, or again, what I described before, moles that they had that have changed. You should be looking over your children probably every month or 2 months, just to kind of give them the once over. If not, you can certainly take them to your pediatrician and have that looked at. But it's really common for kids, even as early as the first few years of life, 4, 5, 6 years old, already getting atypical moles because of skin or sunlight and just exposure.
Do you recommend any specific sunscreen?
No, there's lots of good sunscreens out there. The biggest thing that you want to look for is when you talk about SPF, again, what people don't realize is the SPF is really geared toward UVB. There's really no SPF for UVA, but there are sunscreens now that are called compound or broad-based, and it'll say right on the label if it's a broad-based. That means it's covering both UVA and UVB. So I would recommend one that protects against UVA and UVB. You want one that's water resistant. There's no such thing as complete protection from water. It will cause the sunscreen to be washed away. So water resistant. The better the sunscreen, we sell it here as a medical line. I think it probably is better than some of the ones that you would buy over the counter. So you can check with your dermatologist or a plastic surgeon and find out what lines they're using. But there are some good ones out there. But the biggest thing is the 15 to 50 and also the broad base, so you have both UVA and UVB coverage.
Thank you. Before I transition over to Dr. Talaga, one last question as a plastic surgeon. Will long-term sun exposure give me wrinkles?
Absolutely. And it's mostly the UVA that will do that. So you have to be protected of both UVA and UVB just from an aging process.
Thank you. Hi, Dr. Talaga. I'm so glad you could join us tonight.
Thank you. Thank you. I loved hearing all that. It was great information. Learning some new things.
Can you explain a little bit about why sun safety is important to you in your practice?
Yes, I'm always educating my patients on UV safety for their eyes. UV exposure can cause different ocular manifestations ranging from annoying, like wrinkles, and certainly more severe, like ocular melanoma. And I can go over some of those, but prevention is key. Having the proper UV protection for your eyes can help protect each individual layer of the eye from the surface all the way to the back to the retina. And I tell every single patient that walks through my door for an exam, don't forget to wear your sunglasses when you go outside.
Does the color of your eye make you more sensitive to sunlight?
It absolutely does. Just like Dr. Antimarino had mentioned, with him having the olive skin and me having the lighter skin with, in skin damage, me being at a higher risk, and then somebody fairer than me being at an even higher risk, same thing with the eyes. What gives you the color of your eyes is the amount of pigment that you have. And very light eyes or blue eyes have less pigment, and brown eyes have more pigment. And when you don't have a lot of pigment, you don't have the ability to absorb a lot of that harmful UV energy, and therefore those eyes are going to be more sensitive to different ocular manifestations of UV exposure. So dark eyes have a little less risk for things, for example, like macular degeneration, which is where the macula ages very quickly, and UV light accelerates that, and therefore having light eyes or light skin is actually a risk factor for that particular disease. So it does matter.
Wow. How do sunglasses protect your eyes?
Similar to sunscreen. It protects you. Protects you from both UVA and UVB light, and there are different. Some are better than others, for sure. So I always tell patients you want to look for 100% UV protection. And not only just that, but also get them at a reputable source. I always tell the story. I went with my nieces to the Disney store, and And those Kanye West glasses with like the slits, kind of, there's not even a lens, and it had a tag on it that said 100% UV protection. So you always have to watch where you get them from. And if you're unsure, a lot of opticals will have what's called a UV meter where they can read the amount of UV protection that you have in those glasses. So reputable source, 100% UV protection is what I recommend.
So are cheap sunglasses as effective as more expensive ones?
No, they're not. If you just have a pair of sunglasses that just have dark tinted plastic in them, what happens to any of us when we turn the lights down, our pupils get bigger behind or get bigger in dim light. Similar thing happens when you put on just a pair of dark tinted plastic sunglasses without UV protection. Your pupil actually gets bigger behind that, that lens, and that lets more UV light in, and you're actually causing more damage to the inside of the eyes. So that's why I always recommend good UV protection from a good reputable source.
What do polarized lenses do?
Polarized lenses, I love them, but they're not necessary for UV blockage. Polarized lenses, they will block out certain wavelengths of light so that you don't get as much glare and halos and things and kind of distortion when you have your sunglasses on. So they're great for people who fish, do water sports, skiing. I love them because they just make the image clearer overall. So definitely sort of more of a bell and whistle rather than a necessity.
What sunglasses would you recommend?
100% UV protection and have them from a reputable source. Other than that, you know, you don't really need much more. I prefer bigger frames because that will also help to prevent wrinkles rather than those tiny little frames. But it's all personal preference, really. But just making sure that that lens is doing what it's promising you that it's going to do.
In regards to that, if I don't want to get tan lines around my eyes, where my sunglasses are, how would you recommend avoiding that?
Well, two things you can do. Number one, get a really good concealer or sunscreen that you're wearing. And two, hats. And just limit the amount of exposure that you have to the sun. You know, if you can, come to the shade, take the sunglasses off, and just be smart about that. And hopefully, I don't know, I've been out, and I'm like you. I love the sun. I love to be outside, and I have never once gotten tan lines from sunglasses. So I think if you just remember to reapply every 2 hours with your sunscreen, and take some breaks every now and then, I think you'd be fine.
So protecting my eyes during outdoor physical activities, such as running or water sports, would you recommend the polarized lenses, or is there anything else you would suggest?
For water sports, yeah, absolutely. Polarized lenses are going to cut a lot of glare, make you more comfortable when you're wearing the lenses. A lot of patients will complain, oh, I hate wearing sunglasses, I hate the reflections and things like that. Well, then polarization is going to help you get rid of that. There are different sunglasses made for different things, like if you're biking, they'll have more of a wraparound style, and you can certainly get your prescription in sunglasses as well, which some people sometimes don't realize they can do. It's a little bit more of an investment, but if you don't wear contact lenses, or you aren't lucky and have zero prescription, then have a pair that is made for you.
Do you have to wear sunglasses in other seasons besides summer?
Oh yeah, absolutely. Same as Dr. Antimarino said, even with cloudy days in Pittsburgh and different times of the year, you actually can have more UV exposure even though you're not feeling that hot sun on you. So I recommend UV protection year-round to help prevent changes of the eye.
At what age would you recommend wearing sunglasses? When should you start?
I recommend for even my youngest patients sunglasses or hats. Sometimes it's hard to keep hard to keep sunglasses on the little kids. So hats work well too. But I always say start early because that's when we're outside playing. That's when we're doing most of our running around in the yard and the pool and the beach and all those things. So that's where you're getting most of your sun exposure over your lifetime. And what's important to remember is that UV exposure, the damage from UV exposure, is cumulative over your lifetime. So it's not, just you're out in the sun once and you burn and it's never going to affect you again. Just like you had mentioned earlier, it's going to catch up with you.
What are some of the long-term effects of sun damage to the eyes?
These are things that I talk about my patients too all the time. It's a great question. Mostly both age-related and disease processes. Number one, cataracts. UV light causes the inside of our eyes to age more quickly, and there's a structure called the lens. And over time, the lens is going to age. Just like the hair gets gray, that lens gets yellow. And UV light accelerates that yellowing process so that light can't move through the lens quite as easily, and that's what a cataract is. So the incidence of cataracts along the equator, where people are really exposed to the very harsh sun and sometimes aren't wearing sunglasses, definitely have a higher rate of cataracts. Second, macular degeneration, which is something that can very much cause destruction of your central vision, can cause loss of vision, and it's one of those diseases that doesn't have a real treatment. So the best thing to do for macular degeneration is to prevent the disease, and several factors are thought to accelerate that degeneration of the macula, and that is UV protection, or that is UV exposure. So by protecting the eye from things that cause aging, like UV, smoking, poor nutrition, those are all things I go over with my patients every day to help prevent that disease. And like I touched on earlier, when you have lighter colored eyes, it's the equivalent of having fair skin, and UV light can cause more damage and is thought to accelerate that particular disease process. Other than that, sometimes the surface of the eye, you can get what's called a pinguecula, which is a raised patch of the conjunctiva. They're kind of cosmetically unappealing. People tend to complain about them a lot, but they also cause dry eye, red eyes, and again, those are much more common in very sunny areas like Florida, near the equator, California. We start to see those a lot more, but although I see a ton of them here in Pittsburgh as well, because again, UV is something we need to think about all year round. And wrinkles. That's a big one for me. I don't want wrinkles. So, and I do tell that to my patients too, is I put your big sunglasses on and help prevent wrinkles around the eyes. So those are some of the main things that I try to talk to patients about.
Are there any other methods between the two of you that you would practice sun safety, that you would encourage patients to do? I know you mentioned hats. Dr. Antimarino?
There's some good clothing out there that is, especially for kids who don't want to wear the sunscreen. But there's shirts and pants that are made that really protect against UV light. So you can look into those as well.
I have a couple questions from people that have written in. Liz asked, how do you feel about tanning oils? They usually have an SPF of 8 or 15, but they are supposed to make you tan quicker.
Again, I think that, let's see how to answer that. But I think an SPF of 8 is not going to give you enough protection. So if you're going to use a tanning oil, again, you're using a tanning oil to tan, but you want to use the sun protection to avoid the harmful rays that cause tanning. Remember, a tan is actually damage to the skin. So as much as I said before, as jokingly, is that we all look better with a tan, you have to remember that you're trying to protect your skin. So a little bit of sun, a little bit of tanning shouldn't be a problem. But I would really stay with just a regular SPF and formula, and use anywhere from 15 to 50, and try to stay away from the oils.
Aaron asked, can you get sun damage to your eyes on cloudy days? I never wear my sunglasses then, even though I own 10 pairs from Shadyside Eye Associates.
Yes, you can get exposure from UV on cloudy days, absolutely. So bust out those beautiful sunglasses and put them on. It's going to help prevent a lot of problems down the road. But thank you for the question.
Kira said, I know people that don't wear eye protection in the tanning bed.
Oh my gosh, yeah, no, don't go to the tanning bed, number one, and number two.
Two problems with that statement.
That's two issues. Thank you for that question, but yeah, I mean, there's so much high energy light that's zipping through that sensitive, fragile tissue, and can cause a lot of damage more acutely than just going outside and getting that normal amount of UV exposure. So please put those tell your friend or whoever you're asking for to put those glasses on, and if they, won't get out of the tanning bed altogether.
Right. And you have to remember those tanning beds, they just basically magnify the light. So you're getting a lot of radiation in a very short period of time. So it's concentrated to the point where it's actually even more harmful than being out absorbing the sunlight, just natural light.
So I have a couple comments. Kimberly says, great job, Jeffrey. And Tara Hepler says, you're awesome. One more from Kira. Shady Sides Eye Associates also offers the perfect eye protection for toddlers.
Oh, yes. We have some kids' stuff there as well. So little Ray-Bans and little cute things for the little kids.
Yeah, because I think people don't realize that infants and toddlers, their skin is very thin, it's fragile, and as you said before, if their skin is fragile, so is their eyes. So, I see people, the kids in strollers, but the child's exposed, but the parents have on glasses. But, with a hat or covering over them, you really need to protect the youngest from the sunlight.
Yeah, you're right, there's fragile new skin, so I agree with that.
Okay.
Plus, they'll look cool.
Yes, if you can get them to wear it.
Right, exactly.
All right. Well, listen, thank you so much for tuning in. And if any other questions, you can please let us know. Again, thank you so much for Dr. Talega for being here and helping us push this Shady Shades, or the Shades of Summer campaign, but Shady Side Eye Associates. Please go over there. It's a really nice shop, and it's really good. We go over there. She sees our children, and so I recommend her practice highly. So if you have any other information or want any other information, please see us at www.bellissimoplasticsurgery.com. You can see us on Facebook. And again, we'd like to ask you to donate sunscreen to any of our locations. It's for a good cause, and it's a good education program for women and children.
I'd love to collect the sunscreen at my office too, if that's more convenient for anybody. You can bring it over. I'm just a couple blocks away here in Shady Side from Dr. Antimarino's office, so love to help out with that as well.
Thank you again.